Let's go across first tonight to our first guest, the Deputy Chief Minister of Rajasthan, Sachin Pilot, joining us from Jaipur this evening. Sachin Pilot, thanks very much for being with us. Sachin, your thoughts firstly on the message that emerged from the Prime Minister's meeting with opposition parties today. Does the Rajasthan government concur that it is too early to lift the lockdown? But, what do you think the roadmap of lifting it should be? Do you think a total lockdown should continue or it should be lifted in parts?
I'm of the opinion that whatever lifting of the lockdown does happen, it should be done in a staggered way. It can't be either or approach because we have to breathe life back into the economy. Don't forget 83% of the workforce in India is in the unorganized sector and they're really hand to mouth on a daily basis. So they really need some substance to survive. On the other hand, it's lives versus livelihoods. You can't risk in a country like as big as ours to have a lifting of the lockdown where, again, movement of people will take place. And this infection shows symptoms up to 2 weeks after the one is infected. So really, unless we have a very dedicated and a staggered approach, keeping both things in mind, I don't think we should take any decision in a hurry. I would still wait for the final outcome on the 14th to see where we stand. Don't forget, every day the number of cases is increasing. So we're not in a safe zone at all. If we ever, God forbid, go into the fourth phase, then for a country like India to be able to meet those demands on the health infrastructure that we have, it'll be almost impossible. We must learn from the experience of the US and other European countries. And I know it's painful, it hurts to the people who are at the bottom of the pyramid. They need the essential supplies, food commodities, etc. But we really have to put all our resources in making sure those essential things are given to the people in the bottom of a pyramid. But in Rajasthan, we've been able to have some success in containing parts of the state. Still, about 40 places are at a curfew.
Because Sachin Pilot, what Rajasthan did, for instance, the Bhilwara model that everyone is talking about, you were able to, for instance, create a containment zone there in Bhilwara, which seemed to be emerging as a major hotspot in the beginning. And you have successfully contained it there, not allowing people to go in, come out, and really testing, tracing, etc. Now, that kind of model seems to be now being followed by other states by declaring certain areas as hotspots. It's happened today in Delhi, in UP, etc. Do you think that that could be a model that you could work with, that might be more pragmatic in India, or that it should, for the moment, for at least till the end of the month, be a total lockdown?
Well, I don't think India, we can have a one-size-fits-all solution. But it is true that in Bhilwara, we were able to track patient zero, who was a doctor, and most of the infections came in from the hospital, either through the patients or the nursing staff and the medical staff, and we were able to contain it with the curfew. When the numbers kept rising, we had to have a super curfew and a real clamp down on any movement of vehicles and individuals. And then we had to screen in the city people 3 times over, and we were able to contain the spread of COVID-19. But in India, there are many districts that don't have any infections, but that does not mean that in the next 2 or 3 weeks, we won't have problems there. So we rather err on the side of caution, may take the bit more pain that comes our way, and still keep ourselves alive, quite honestly. And that's the only way forward. I know it's a tough time for all of us, but we have to really take this at a human level, fight as one nation, as one people. All this opposition, government, leaders, ideologies, it can all take a backseat for now. We must stand up together because people of India expect us to show that leadership and statesmanship from every single one of us.
In that case, what is the kind of help that Rajasthan would need from the centre? Now, a lot of states, I believe, have expressed the fact that, they just don't have enough money to deal with this crisis, both in terms of, having to give money to the poor, wages, etc., financial packages. You all need more help from the centre. Have you asked for more help from the centre? What has the centre said? How much money do you need?
Oh, absolutely. I think every state will need financial assistance and hand-holding because in a crisis like this, and don't forget, India lives in its villages and towns in the states. So it's okay for New Delhi and Government of India to make announcements, but the actual caring for the patient, the cost of beating this virus lies on the states. And I think there should be a proportionate special financial package to all the states that have a high propensity for infection and number of infections right now. So they must prorate that. But I think a dedicated specific financial package to all the states that have faced this problem needs to be given because the income is zero now. I mean, there is no economic activity in most parts of our country. So obviously states anyway were on a very weak wicket in terms of finances. But with this particular challenge, we made about provisions of about 100,000 beds. That's a target in the worst case scenario. Every district headquarter has now, we've taken over some private hospitals. Like in Bhilwara, we've taken over some hotels and some private hospitals and dharamshalas, if the spread was too much. So we made provisions. Our paramedics, our doctors are working 24/7. The administration is fully dedicated. And more importantly, Nidhi, the people are cooperating. No curfew can be successful if people don't cooperate. So all those people who are violating the lockdown norms and curfew really are doing a huge disservice to themselves and to all of us. And that sensitivity has to be brought in. And I think most people realize that if we let this go, there is no coming back. There's no vaccine or medicine for this disease. We have to do social distancing and prevent it by staying home. I know it's painful for all of us, but we don't really have a choice, and we have to take it head on and do it collectively.
Finally, Sachin Pilot, on the issue of testing, is Rajasthan going to step up its testing protocols? Are you going to be in increasing the scope of that?
I think that's crucial, and that's something we haven't done enough. Rajasthan, we've done a lot of testing. I think we're number 2 after Kerala. But we have to start doing random sampling, random testing. So we are importing many kits from China, for example, to make sure that we have random sampling. Unless you do more testing, there is no way we'll know the true tenacity of this virus, because right now the numbers that we see, to my mind, are quite mitigated because we haven't tested enough. So unless you test, like we've done in South Korea, in Germany, for example, unless you test, that's when you get the real sense of the problem. And then we have to accommodate for our ventilators, for our oxygen beds, for our hospital beds, PPE kits, hazmat. So all of that needs to be done. That's why I think a further staggered removal of the lockdown is perhaps the most practical way to move ahead.
All right, Sachin Pilot, the Deputy Chief Minister of Rajasthan, joining us there on NDTV this evening. Thanks very much. Rajasthan clearly favouring a cautious approach, an approach which advocates a staggered exit of the lockdown whenever the country is ready for it. Thank you very much for joining us.